So a few notes on pediatric pain management, starting with infants. So the hallmark of infant pain management, especially during a procedure, is the use of sucrose and non-nutritive sucking. So there's tons of research on this, very commonly used. We use them up to about age 2. You don't need a provider's order, you can just do it. So depending on what we have on our supply chain, you may have the Sweetum little cups that you'll need to use a 1 ml syringe, or you may have Sweeties that are the little squeeze top. They look like eye drops, the individual eye drop ones, and then the suck is a pacifier. So always ask permission before you use sugar or pacifier, especially with a newborn or a small infant. Some parents don't want that used. There's a lot of research also about the use of breast milk for pain relief during painful procedures. Read a recent article on smelling breast milk. There's also been some articles about nursing during procedures, which is very hard to do. And then also of syringing in breast milk, or putting breast milk on a pacifier. So any of those would be options if the parent wants to do something like that instead of sugar. But again, this should always be the parent's choice. You should always get permission. Swaddling can also be really effective in pain management for small infants. Swaddling for sleep is a slightly different topic. So the current American Academy of Pediatric recommendation is that you don't swaddle arms for sleep, especially once they start rolling a little bit, because if they were to roll over on their stomach, they couldn't push up with their arms to clear their airway. But for procedure, I often swaddle the opposite area. So if I'm doing the left arm, I might swaddle their whole body except for the left arm, or I might swaddle the legs and torso and leave the arms out. If I'm doing a heel stick, I'll swaddle the arms and torso and leave the foot out. Swaddling can also be effective for syringing, like if you're doing bulb syringe of the nose, just to keep some of the squirmy arms out of the way. So swaddling can be a pain relief and also just a positioning aid for doing procedures on infants and small children. Touch is a very effective pain relief for children and infants. Infants need touch. So being held, being touched, having their face stroked, all those can be very powerful for infants. A couple of notes about medication. You don't give Motrin under 6 months, so it won't be ordered. And then if you were to give a Tylenol suppository, because it's a bullet shape and so it's narrower at the end, you may have to cut it lengthwise so that you get the proper dosing if you need a half a suppository. CARP has a great program on the 5 S's to soothe a crying baby that I think is really helpful to know. I've used these with my own children and lots of children over the years. I actually feel like at some point there were 6 of them. So this is the current 5. Swaddle the baby positioned either their side or their stomach towards yours. So not that they're sleeping on their side or their stomach, but this is when you're holding them. Going shh, and I often do a shh, 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 shh. Swing and suck. And so the idea is that you kind of put them all together in this thing, and then you do it all. And I could swear there used to be a swat, which was kind of a pat on the bottom. So you take your baby, you swaddle it, you hold them to you, their belly towards you. Often I'll hold them upright so their head or their ear is up against my throat or my upper chest while I'm going shh, 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 while I'm swinging or swaying. And they have a pacifier in their mouth, and then I'm patting their bottom. So you have to give it a few minutes, especially if they're really crying, but usually that combination, if you can stay calm, will get them back calmed down. This can be very useful if you're a night shift nurse and you have woken up a child in the middle of the night. So depending on how far you've woken them up, you may just need to do the kind of patting, then the shh, 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 shh. I do a lot of the shh, 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 if I've woken up a baby or partly woken them up. But that can be very effective. And then trying to get them before they really cry awake. But yes, if you're working night shift or you've woken up a baby, these can be really helpful things to know. For older kids, don't forget about ice and heat. So always only use the chemical heat packs that we have, which I couldn't find a picture of, so you get a warmie instead. So Centera policy is that you can never heat with something that isn't a chemical heat pack or isn't a warm blanket. So we're not filling gloves with hot water or anything like that. It has to just be our warming pads, our K-pad, or a warm blanket. So don't use anything else. And then our ice packs would just be whatever we have, the frozen ones, and then making sure that you have a layer of a thin blanket or pillowcase between the patient and the ice pack, so as not to have skin damage. But for post-op fractures, ice, we use ice packs on the throat for tonsillectomies. Heat helps tremendously in starting an IV. It may also be comforting if an IV is hurting or something else is hurting. Obviously, get orders if you need them for any of this. Tylenol, Motrin, and opioids. So depending on the child and what procedure, Motrin may be more effective than anything else. So there's a lot of research that says that Motrin is more effective than an opioid for fractures. Of course, you may still need some opioids, especially after surgery, but don't discount the use of Tylenol if appropriate. Distraction, there are lots of kids up into teenagers that don't seem like they're in any pain because they've been distracted by family or video games or TV. Distraction can be very powerful during a painful procedure. So if I'm setting up for an IV, I'll pull out a phone or ask mom to pull out a phone, or we'll watch a video. And then during an actual painful procedure, like actually during the stick, distraction doesn't work. But if I can distract before and after, if the child can be sitting up before I start an IV, it tends to go better, so then they're not so stressed out the whole time. But do know that kids who have been distracted, who haven't felt pain when visitors leave or the video games are turned off, the pain may become unbearable. And it may feel to us like, oh, well, are you really having pain because you haven't seemed to be in any pain all day? But just know that distraction is a very powerful pain modifier for children, and it may have just masked all the pain.